years. I am a pediatrician and the Congressional Fellow for Physicians for National Health Program. And so the public option is a publicly financed insurance plan that would be offered in addition to the huge number of insurance plans that we currently have. So it's adding one more insurance plan to the mix of all the many that we have. It's not a panacea, it's not a solution that's going to address the real fundamental problems that we have in this country. On the other hand, we have the single payer bill, which is actually a comprehensive health care reform where all of our medically necessary care is publicly financed. What it means is that every single person in this country would have a health care card. You get that card when you're born and you keep that card until you die. You don't have to worry about losing it when you change things in your life. It covers all medically necessary care. It's very comprehensive, including dental and vision and prescription care. There are no copays or deductibles, so when you need to get care, you don't have to worry about whether you've got the money to go see the doctor. You can go and see the doctor, and it will end medical bankruptcy in this country. And under a single-payer system, every doctor is a participant, so you have complete choice of which doctor you want to go to, no matter where you are in the country. You choose your doctor and you choose your treatment. So it really addresses all these problems that we have, whereas the other legislation is not, doing that.
So how in the world can the country pay for that?
That's the beauty of it, is that a national single-payer health system is the only health reform that has built-in cost controls. The current legislation that they're looking at, H.R. 3200, actually adds cost by, trying to regulate insurance companies, which will be expensive, and other measures subsidizing the purchase of private insurance. Under a single-payer system, because you have to look at it this way, in our country, we spend 2 to 3 times more per person already than the other industrialized nations do, and we have poor outcomes. It's because we're wasting so much money through having all of these different payers. Under a single-payer system, our administrative costs will be greatly reduced. Medicare spends about 3% on administration. With private insurance, we spend at least 30% on administrative costs, so there's a big savings there. Also, hospitals will be given global operating budgets, so that makes it much simpler for the hospitals to function. They know how much money they're getting. It saves them money to kind of not have to be out haggling with insurance companies. Another big savings is that we'll be able to negotiate for the cost of pharmaceuticals and medical devices. We already pay 3 to 9 times more for these things in this country because we don't negotiate. So a huge savings there. So between the budgeting, the negotiation, and the administrative simplicity, that offsets the rise in costs of needing to pay for people who aren't currently getting care, and it actually comes out with a savings over time. It's the only legislation that is actually cost-saving.
Now, can you tell us a little bit about the study that you mentioned earlier and the event that's coming up September 20th?
Sure, thank you. Yeah, there is a new study coming out on September 16th, which is looking at the number of people who die in the United States each year because they don't have access to health care. And it's a very high number. I can't share that publicly yet because the study is not out. But September 20th to September 27th is Health Justice Week, and there will be events nationwide around health justice where we highlight the fact that so many people are suffering and dying in this country because we don't have a health system. So in Washington, D.C., what we have chosen to do to make it very visible to the White House and to Congress is that we have an area on the National Mall where we're going to be placing American flags to represent the people who have died. And each day we're going to add more flags to represent the people that have died that day. So often, I remember just last week with the fires here in Los Angeles, hearing that 2 firefighters died, and I thought that's hugely tragic that they died trying to put the fire out. But it's hugely tragic that many, many times more people died that same day because they didn't have access to health care. But that doesn't make front page news. So we'll be telling these stories and putting more flags down each day during that week and educating people as they come by. Did you want me to tell about the other event at the end of the month?
Yes, please.
Too,
and then tell us who is the we who is doing this and your website.
Okay, sure. So at the end of the month, there's a group of doctors who they bought a caravan and they're leaving. They've left Seattle, Washington. They're driving across the country. They're heading east and south and north and finally south again to Washington, D.C. And they're called the Mad as Hell Doctors. Their website is madashdelldoctors.com. And basically they're raising awareness and spreading the word about single payer as a solution and telling their personal experiences about why they believe this is the solution. And they've asked President Obama to meet with them when they come to Washington. And so far, the president has not given them an appointment. And so they're asking people to send letters to the president asking for him to meet with them. And when they arrive in Washington on the 30th, if the president doesn't meet with them, we're actually holding a mock presidential meeting outside of the White House in Lafayette Park, and we'll invite people to attend that and bring their support for that. When I say we, sorry, it's been a long day. When I say we, I'm referring to the Leadership Conference for Guaranteed Health Care, which is a coalition of organizations that believe health care is a human right and educate and advocate for single payer. And nationally, we represent over 20 million people. And people can learn more about that. One website that's very excellent is healthcare-now.org. You can learn about events that are going on. You can download resources, flyers, things that you can hand out. Or you can go to pnhp.org to learn more.
Do you think the public option is going to work, and what do people who believe in single-payer health care need to do here in the near term?
Okay, thank you. The public option, like I said, is not going to address the fundamental problems that we have. Even this so-called robust public option is not going to change those. It's not going to give us the cost saving we need or create a system in which everybody can get health care. There's still going to be 10 or more million people left out, even with the public option. So we're going to continue building our movement and pushing for a national single-payer health system until we get there. Right now, as we've seen in Washington with the opposition, the public option has been weakened and may actually come out of the legislation altogether. So we have an opportunity right now to really, while people who saw the public option as a solution are seeing that is falling apart, we can bring those people on board with our movement and push for real health reform, a single-payer system. So I think education is key, putting pressure on our Congress members, or just really educating them. A lot of them still don't understand. And then this is a human rights movement. If we are actually going to overcome the forces of opposition and create real health reform, we've got to view it as a campaign, like a human rights movement. And so there may be more opportunities where we can use dignified, nonviolent civil disobedience to make our point that we need a health system that's going to create better health and save lives.